we talk about surgery for erectile dysfunction, then we have probably already exhausted many of the other treatment options that are available. As a last resort then, we will discuss with patients the option of surgical intervention. What this requires is implantation of a penile prosthetic device. Now, penile prostheses have been used for hundreds of years historically. Many years ago, people actually implanted fragments of bones into the penile tissues, and this allowed patients to have a firm penis. Now, penile implantation therapy has come a long ways. We no longer implant bones, but we have prosthetic devices that can be used. And these come in many shapes and forms. We have something called a semi-rigid penile prosthesis, where the erectile bodies are identified, the tissue within the erectile bodies are cored out, and we insert malleable rods directly into the penis. These rods are firm all of the time. They can be manipulated to different shapes and angles. This is the simplest form of a penile prosthetic and requires insertion of 2 rods within the penile tissues. There is also something called an inflatable penile prosthesis, and these come in also several different types. The principles are the same. These generally have anywhere from 2 to 3 components depending on the type of prosthetic you are using. And they have cylinders that go into the penile tissues, and in their natural state they are deflated and soft. However, there is a system whereby fluid can be pumped into these cylinders to make them firm and rigid. And there are various different pump mechanisms and things like that. There is a device that is a 2-piece unit, which is comprised of the cylinders, as well as a reservoir and a pump, all contained in one, and usually that reservoir and pump is contained within the scrotal area. The 3-piece unit has 2 cylinders. The cylinders are connected on one end to a reservoir, which is a sac that is filled with fluid, and then on the other end to a pump mechanism or an activation mechanism that is then implanted into the scrotal area. Again, in the natural state, these cylinders are flaccid, and when you're ready for sexual activity, then you would activate the activation or pump mechanism that will then trigger the cycling of fluid into the penile bodies, into the penile cylinders. A couple important things to note with surgical therapies. It is not a way of increasing penile length. In fact, in many cases, the length will actually shorten slightly. It does require a surgical procedure where there are incisions. Also, these are mechanical devices which are prone to all of the potential consequences or side effects that we can see with mechanical devices. This includes things such as infections. Infections can be a serious complication when talking about penile prosthetic devices, and if there is an infection, then these commonly have to be removed. Also, you should note, once you have this procedure done, you can no longer ever have normal erections or even the ability to have normal erections, because during the procedure, the normal erectile tissues are completely cored out and they will no longer function normally. So it is a procedure which can benefit many patients in the appropriate circumstances, but you should seriously consider some of the potential risks and long-term potential side effects to these types of products, and this should be discussed extensively with your surgeon or with your urologist prior to undergoing this procedure. You should also talk to them about the potential alternative treatments that are available prior to undergoing surgical intervention.